Hey, welcome back to Optimal Vitality's podcast in honor of March 30th, which is National Bipolar Awareness Day. We are spending time talking about bipolar disorder. If you tuned into our session before, we spent time talking about what bipolar disorder means in layman's terms and what the symptoms look like. In today's podcast, what we're going to do is spend time talking about the neurotransmitters involved, as well as the different areas of the brain. Now, I had really thought about getting a whiteboard to be able to draw this out for you guys, but when I practiced, it turned out my drawings are not very, very good. So I'm just going to refer to the different neurotransmitters involved and then how they're involved. And then I have an awesome little brain to be able to show you the different parts. And then after I have put you to sleep with my neuroanatomy, you'll be good to go. So, what neurotransmitters are involved and what exactly are neurotransmitters? So neurotransmitters are essentially chemicals within your brain. They're floating around and they get absorbed by different parts of the brain and different synapses and things. So the pathophysiology of bipolar disorder, you don't necessarily need any kind of like medical background or psychology degree to truly understand. What it is important to know is that there are some main neurotransmitters involved. And what we know is that they're not getting absorbed right in the brain. They're not being taken in within the neurotransmitter areas of the brain at an efficient rate or at the right amount. And that is then leading to the symptoms that we're seeing in a person. So, some of the main neurotransmitters that are involved include norepinephrine, or it's also called noradrenaline in some situations, dopamine, and serotonin. There have also been some suggestions in certain studies that GABA and glutamate are also involved, as well as some mitochondrial dysfunction and oxidative stress. But we're going to spend most of our time talking about dopamine, norepinephrine, and serotonin, because those are the three ones that mean the most to us, and we can explain this easily. So, dopamine and norepinephrine, what are they? We're going to start out with what we would call norepinephrine, or in some situations is called noradrenaline, and it does mean a lot of what it sounds like. It is almost like your adrenaline response to situations. So here is what it looks like from a chemical composition standpoint. Hopefully you're able to see it without the lights that I'm using to make myself look undead shining as a reflection in it. So what is it involved with? Well, it is involved with arousal, sleep, a response to stress, and essentially our fight or flight response. And then it's also involved with a lot of biological functions like our GI tract and how we respond to our stress, and our gastromotility in terms of when we're digesting food. It also affects our heart rate, our breathing rate, and all the things that we would associate when we are in a fight, flight, or freeze situation. So where is it located at? I need to get a laser pen, I think, but I do not have one right now. So it essentially is absorbed incorrectly, for lack of a better word, in your frontal lobe area, as well as in the locus coeruleus, which I'm sure I do not pronounce right, but I do the best that I can. Essentially, what happens is that in symptoms of mania, these levels are too much. You're getting way too much of it, so you have this excessive energy level, excessive arousal. It's just too much of it. You have that almost like a constant flight response. You go, 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 go. If you're having too little of it, then you're going to have the opposite end of things, where you're going to experience much more symptoms like depression. That sadness, that lack of arousal, that lack of energy, that lack of ability to do things. And that is how, essentially, norepinephrine contributes to or participates in the symptoms of bipolar disorder. Next, dopamine. Dopamine is my favorite neurotransmitter. So here's what it looks like. And this is what is getting absorbed incorrectly in aspects of bipolar disorder. So dopamine is really, really important. I'm sure a lot of you have kind of heard about dopamine. It helps with attention and arousal. And it is also substantially impactful for motivation and being able to get things done, as well as the reward and pleasure-seeking parts of our brain. There's also aspects of it that are involved with memory formation and retrieval, aspects of sleep, and aspects of learning, as well as other bodily functions, much like norepinephrine. Here's what happens with dopamine. Dopamine is synthesized as well as absorbed in different areas of the brain, and where it is absorbed influences what that part of the brain does, right? So I'm going to get out my trusty little brain again. Here is the frontal lobe, right? So how dopamine is absorbed here is what is impacted in terms of attention and motivation, aspects of thinking, working memory, and the start of the formation of memory, and also the retrieval of memory. So when this becomes haywire, much like we saw with norepinephrine, if you have too much or it's not being regulated correctly, you're going to be either excessively seeking pleasure and reward and have hyper focus on things, much like what we see in mania, too much arousal. You're not getting enough, then you're going to be much more lethargic, not have a lot of energy, not have enough motivation, and those are the symptoms that we see with depression. It is also involved in other aspects of the brain, which then lead us to different side effects that we'll talk about can happen with the medication when we take it to help regulate things. But it is a really important neurotransmitter, and as I stated, one of my favorites. It is one of the primary reasons that people have one of the excitatory symptoms of mania, but also the hallucinations, delusions, and aspects of that paranoid thinking because of how it is being impacted in this area of that brain. So there's a little bit of information on dopamine and how it is involved in your frontal lobe, okay? Next is going to be serotonin. Wonderful serotonin, right? So serotonin is actually involved in a lot of different things. It's involved with bodily processes like thermoregulation, perception and understanding of pain. It's involved with learning and memory. It's involved with sleep and sexual activity, aspects of your GI tract, as well as motor movements and happiness feelings. There are a variety of places where it is located throughout the brain. It is mainly in the ref nucleus, which again, I'm sure I do not pronounce right, but just bear with me. And then there's a whole circuit that it travels much like dopamine throughout the brain. And based on the different areas of the brain is where it is impactful for the different bodily systems and different parts, right? So in certain parts of the brain, in this area, it's going to be impactful with aspects of attention and learning and memory, as well as down here. And then there's also going to be aspects of it that are involved in your digestive system, as well as how your blood vessels dilate, which again is involved with that response to stress and depression and mania, as well as it impacts cardiovascular functioning, dopamine production, and aspects of cognition, right? So what happens when we have too much and too little? Too little of serotonin is essentially going to be associated with sadness and crying, feelings of hopelessness, feelings of helplessness, many of the symptoms that are targeted with antidepressants and SSRI-related medications. Too much is going to be associated with some of the, again, physiological components that we feel when we are experiencing heightened energy in terms of vasoconstriction or vasodilation, gastrointestinal movement, hyperfocus on things, heightened senses, and an irregular perception to temperature and pain, right? So people, when they are depressed, their perception of pain is much different than if they're manic or full of energy, right? Their perception of temperature and their ability to essentially interpret how temperature is impacting their body's regulation is different based on whether or not somebody's going through depression or they're going through symptoms associated with mania. And I promise you that we talk briefly about some of the other neurotransmitters, or at least identify the other neurotransmitters that can be involved, which include GABA and glutamate, which are excitatory neurotransmitters. Again, as we talked about before, if you or anyone you know is suffering from uncontrolled symptoms, please encourage them to get help. Or if it's you, please encourage yourself to get help. Uncontrolled symptoms are very impactful in one's life, and it makes it very difficult to live at somebody's optimal level. Please feel free to call us to explore treatment options. You can also email if you'd like. Our contact information will be at the end of the session.